Hey, deserving listeners, a lot of you have been asking me to watch the Psychiatrist for the Amber Heard team talking about Johnny Depp. Let's watch. My name is Dr. Kirk Honda. I'm a therapist and a professor. Let's see what happens.
Dr. Spiegel, could you please just summarize for the jury the conclusions you came to with your opinions, and then we'll take you through the specifics.
So, in my opinion, based on my review of the evidence, based on my clinical experience, based on my publishing experience, based on my teaching experience, that Mr. Depp has behaviors that are consistent with both someone who has a substance use disorder as well as consistent behaviors for someone who's a perpetrator of intimate partner violence.
All right, so to catch you up, this is Dr. Spiegel, who is Amber Heard's forensic psychologist expert witness. He talked about all the things that he reviewed. He reviewed all the evidence that is available to the court. He reviewed all the therapist records. He reviewed the pictures, the audio, the UK trial, the forensic psychologist reports, and I believe their specific findings. He, I think, interviewed Amber Heard, I'm not sure. He reached out to Johnny Depp and his legal team to interview him, but I think that's customary because the Johnny Depp legal team knows that if the expert witness has a chance to evaluate Johnny Depp, then it gives it more credence, whereas if he is diagnosing from afar, having never talked to Johnny Depp, then that is less convincing to the jury, I think. And from what I understand from the attorneys who have explained all this to me, specifically to this case, that because Johnny Depp isn't claiming that he has PTSD or anything like this, he doesn't have to succumb to an evaluation, whereas Amber Heard does, because in her countersuit she is claiming that she has PTSD as a result of Johnny Depp, and thus she apparently has to allow the opposing legal team to hire a forensic psychologist to evaluate her, which is why Dr. Curry was present. So if that countersuit wasn't around, then I imagine that this Dr. Spiegel would be the main psychology expert witness. And so the Amber Heard legal team hires him and says, I want you to look at all the data available that we have, and I want you to offer an opinion to the court. And so his opinion is that Johnny Depp's behavior is consistent with a substance use disorder and with intimate partner violence. So on one hand, we could take that and say, absolutely, there's tons of evidence from his own account that he absolutely suffered from a substance disorder. Plus, I believe he's been officially diagnosed by several clinicians to that effect. So when it comes to a substance use disorder in the DSM, there are criteria that you must meet. They're kind of loose, to be honest, especially in DSM-5. They lowered the bar, if I remember right, such that you can now qualify for a mild substance use disorder with fairly low-grade symptoms. Not that it's abused in that way. All right, so alcohol use disorder is a problematic pattern of alcohol use leading to clinically significant impairment or distress as manifested by at least two of the following occurring within a 2-month period. So a problematic pattern of alcohol use leading to clinically significant impairment. Impairment, what they're talking about is impairment in your relationships, at work, and other domains like that. Or distress. So they're saying that, let's say your life is going pretty well, your relationship is going well, your work is going pretty well, but you have a lot of distress as a result. So it's a pretty open-ended word right there. Plus, what constitutes a significant impairment clinically in one's life is being hungover once a year and not making it to work. Is that significant impairment? There's a lot of judgment call involved in this. And that's why we always just have to recognize that the DSM is not hard science. Like when you're trying to measure the mass of an object, that's a discrete number. There are instruments that measure mass, and you just use those instruments and you get a number, and it's, probably within a small margin of error. But when it comes to diagnosing, now, did Johnny Depp suffer from alcohol use disorder? Yeah, I'm just going to say that that's probably a confident thing. But I'll get into diagnosing from afar in a second. But anyway, so two of the following within the past 12-month period. One, alcohol is often taken in larger amounts over a longer period of time than was intended. It's a classic sign. So often taken. What's often taken more than you intended on? Is that once a month? Is it once a week? Is it 5 times in 12 months? What does that mean? Now, I will say that as someone who has diagnosed people with these disorders and have worked at a chemical dependency clinic for a while, that the instruments and the thresholds are pretty standard. People who work in the field don't have a hard time with this sort of diagnosis. Plus, it's not so important in the treatment world exactly where we put someone. We will see that they're struggling, and we don't have to necessarily say, well, this person is struggling more than that person. We just say, well, all these people are struggling to some degree. Let's put them through the treatment program, help them get sober, help them recover from trauma, that kind of thing. Number 2, there is a persistent desire or unsuccessful effort to cut down. So right there, if you qualify for the disorder if you've taken it in if you often take it in larger amounts than you intend, and you have a persistent desire and you're unsuccessful in trying to quit. Number 3, a great deal of time is spent in activities necessary to obtain alcohol, use alcohol, and recover from its effect. So it's a pretty classic sign, again, of having a compulsive problem. The individual will be at work and will be thinking about, okay, when am I going to have my next drink? How am I going to have my next drink? What is the drink going to be? How do I manage my hangover tomorrow? Because surely I'll get hungover. It's a lot of preoccupation with the use. Number 4, craving. Number 5, recurrent alcohol use resulting in a failure to fulfill major role obligations at work, school, or home. Number 6, continued alcohol use despite having problems. Number 7, important social, occupational, recreational activities are given up. So if you have a family gathering and you're just like, well, I don't want to be shamed for drinking, so I just won't go. Number 8, recurrent alcohol use in situations where it's physically hazardous, like driving drunk. 9, alcohol use is continued despite knowledge of it causing a problem in your life. Number 10 is tolerance, physical tolerance, meaning that you need more to have the same effect. And number 11 is withdrawal symptoms. Given Johnny Depp's own account, and especially when we take everything into consideration, would he qualify for a severe alcohol use disorder? Yeah, I think so. But in regards to the intimate partner violence label, that's not a diagnosis in the DSM. There's a different set of criteria that is not necessarily codified in a manual like this, but there's a general sense, and there's various different criteria sets that people will use. So could we say that it's reasonable for Dr. Spiegel to say confidently on the stand that Johnny Depp was a perpetrator of intimate partner violence? That one's tougher, because a lot of people looking at the data here, I think including some of the jury, would say that his physical behavior was defensive in nature, and many of the accusations against him are potentially exaggerated or just flat out lies. But if you believed at least even half of the allegations made by Amber Heard and I believe some of her witnesses, then yeah, you could apply that label of someone who is a perpetrator of intimate partner violence. I wonder if they're going to ask him what they think of Amber Heard's behavior, because I doubt this will happen since it's Amber Heard's expert witness. But one could possibly say, according to my definition or the standard definition of intimate partner violence that I'm using, Johnny Depp and Amber Heard both qualify for the label of perpetrator of intimate partner violence. Who was more of the abuser, I can't tell, but it looks like there were a lot of control, a lot of anger, a lot of intimidation, and a fair amount of violence, some of it really quite atrocious, that both were committing alternatingly, sometimes at the same time. And was someone being abused in the sense that they felt intimidated and under someone's control, gaslit, those sorts of things? I don't know, but I do know that both people were clearly abusive, verbally, emotionally, and physically, and potentially sexually, at least from Johnny Depp. So could someone say that? Yeah, but let's talk about diagnosing from afar. So Dr. Curry and Dr. Hughes both had contact with the person in question that they were diagnosing Amber Heard. Dr. Spiegel never had a talk with Johnny Depp. So he is diagnosing completely on people's reports and audio and all those kinds of things. So is that ethical? Well, it's a gray area in this situation, because in forensics, so in my world, I would never do that. we would never do that. Now, you could argue he's not officially diagnosing. It sounds like a diagnosis to me. When a qualified assessor, evaluator says someone, meets the criteria for, they're essentially saying, I am diagnosing this person with that, because that is what it is. But maybe he draws a distinction there. Now, in forensic psychology, sometimes we are called upon to diagnose from afar in this way. So say that someone has committed a crime, a terrible crime like murder, and is detained as a suspect, and they are awaiting trial. And there's a question as to whether or not that individual who allegedly committed the crime was insane at the time of the crime. Well, the forensic psychologist might be involved, usually would be, always would be in a situation like that, and would evaluate the accused. And let's say that the accused refuses to participate in that evaluation. I'm not exactly sure what would happen in a situation like that, but I could see a scenario, because I never had a situation like that, but I could see a scenario where a psychologist would make do with data that they could get without even having the ability to interview or test that individual. You would gather a lot of outside information as to the state that the individual was in at the time of the crime, especially if there was strong data indicating something, like they had a history of schizophrenia, they were known not to be on their medication at the time, they were known to be non-compliant with treatment frequently, there were scribblings on a piece of paper, they left a voicemail on someone's phone that clearly indicated signs of schizophrenia. The individual might have even reported to someone that they were seeing things or hallucinating. And, you put all that together and you think, yeah, this person was in the throes of a schizophrenic episode. And I'm confident in saying that, even though I haven't had a chance to talk to that individual. There are situations like that where you don't have any choice. I don't know if this really qualifies, though, right? So I'll say that if I were asked by the Amber Heard team, and even if they offered to pay me a lot of money, I would say I can't diagnose from afar. If Johnny Depp won't agree to meeting with me and talking with me, and even then I might say, how am I supposed to know? You've heard me rant and rave about that already. And it's one of the reasons why, as I was trained as a forensic psychologist, but never actually wanted to do that work. So in conclusion, about diagnosing from afar, generally speaking, it is considered unethical, even though a lot of people on the internet will diagnose people. When Donald Trump became president, there were a lot of clinicians who went on record and actually diagnosed Donald Trump, even though they had never met him. And you would have very little information in terms of diagnosing someone. I think they even diagnosed him with a personality disorder, which is even more difficult to do. Could they be right? Yeah, I'm not saying Donald Trump doesn't have a personality disorder, and I did a whole episode on that. You can search on my channel, is Donald Trump narcissistic, I think it's called. I didn't have that much information at the time, and I think I talked about the ethics involved in diagnosing from afar. It's clear in our ethical codes, you cannot diagnose from afar. You can say that person looks like they might have this issue, but I don't know, because clinically I haven't evaluated them. When Barack Obama became president, there were lots of people, clinicians, who came forward publicly stating that Barack Obama had narcissistic personality disorder. It's a very common thing that people will do, and in my opinion, these people are hacks because they don't understand the ethical codes that are clearly written. There's the Goldwater rule that was clearly established a long time ago. It's clear. There's no wiggle room there. You can't diagnose a politician having seen them give speeches. Can you, as a clinician, publicly state that you believe that politician is a problem politically, the way that they vote, the way that they talk? Sure, but you can't diagnose. Plus, even if someone did have narcissistic personality disorder, that doesn't mean that they're going to be a problematic president. It doesn't mean that they're impaired necessarily. It could mean that, but it doesn't necessarily mean that. Plenty of people with narcissistic personality disorder function fine. But as I said, is it pretty easy to look at this case, at all the data, and state what he just said? Yeah.
In your practice, do some patients suggest to you that drugs and alcohol actually help them?
Patients who lack insight or are in the very early stages of recognizing they have a quote-unquote problem will sometimes actually say that they have, this medication actually calms me down, this medication makes me feel better.
Yeah, I think I was saying this at the time, that the way that Johnny Depp talked, I don't know, it's hard for me to tell, but given my experience with people in recovery and pre-recovery to their substance use disorder, Johnny Depp talked like someone who was below the threshold of true recovery. The way that he talked, he says, I can quit any time. I did quit often, even though I was using several other substances on the side, some of which are prescription, but who knows exactly what's going on there. But yeah, I could quit any time and I'm okay, and it actually helps me. It helps me to calm down. That's why I was drinking at the time. She was stressing me out. I needed to drink, and that is the end of the story. That's just a classic way of justifying one's use. Oftentimes, though, the individual believes it. If you hook them up to a lie detector, which doesn't exist, as I always say, the individual would pass, because the addict mind convinces them of this, because to think otherwise, they have to face the fact that they have a problem, which is a very threatening thought to them, because they are addicted, and they don't want to think about that, because they don't want to have to think about the fact that they have to quit, because that would threaten their connection with this substance that they feel as though is critical to their functioning, when it is not usually.
And in actuality, they may not acutely feel anything, but chronic and continual use will take its toll on the brain. So the answer is yes, but again, people who have substance use disorders have lack of insight and a lack of judgment about what's going on.
I will say this guy's a little quirky. I'm getting like Doc Brown vibes to some extent. I mean, there's nothing wrong with that, but I just wonder how that comes across to the jury. So yeah, what he's saying is that, sure, the individual who is using might feel as though the use helps them in the beginning, particularly, but chronic use over time, overall, the net effect is highly negative. So although Johnny Depp would say, look, I drank to calm down, and I'm totally chill, and I never get drunk, and I can drink like a fish, and everyone around me says that I handle my alcohol just fine, it's not a problem. It's just a classic presentation from someone who either is actively in denial or just subconsciously in denial. I don't know. I mean, I can't know anything about it. There wasn't strong evidence that his alcohol use was causing any of the problems that Amber Heard alleges. Who knows? But I tend to believe Amber Heard when she talks about how his use was pretty severe. And who knows, if Johnny Depp wasn't in this trial and trying to win, maybe he'd be able to admit it. And he isn't in denial of it. And who knows where he is at right now with his use. Maybe he is in recovery. I don't know. But yeah, people tend to talk that way. And then as they use over time, not only, and he said it affects the brain, which is true, but it's hard to know exactly how and in what way and how it affects particular individuals. But generally speaking, it absolutely will just ruin your life. It takes over. You imagine just with alcohol alone that the numbing agent gets you through a time, say you drink occasionally. This is a common kind of path for people who have a problem with alcohol, and it usually starts early, and I think it did for Johnny Depp. But, say you're in high school and you have past trauma and you feel awkward around other people and you're trying to fit in, you're just trying to get through the day, you have a lot of pressures, and you go to a party and you have some alcohol and you suddenly feel relaxed and you're talking with other people and you have like this really great time and you're buzzed and you're euphoric and you're charming and people like you and it's this wonderful experience. And you go home and you're like, wow, that was pretty great, the party. And then you say you go to another party, but you don't drink that much or there isn't alcohol there, and you're like, you're your old self, so to speak. And then you're like, oh, it must have been the alcohol. So you start drinking more and more. Then before long, by the end of high school, you might even be drinking before you go to school. You have really elaborate ways of covering it up with breath mints and stuff. And this is also a similar path with marijuana. Alcohol and marijuana are really common abuse substances to high schoolers. Certainly they can get into opiates and heroin and cocaine and meth and all those things as well. But the prevalence and the availability of marijuana particularly is really high. So the individual is using now and they feel relaxed more often, and they, overall, you could argue that within a couple years, the individual's life is enhanced. They're more social, they have higher self-esteem, they have friends now, they feel good about life, they feel good about the future, they're getting out of the house, this kind of thing. Well, pretty quickly, particularly with teenagers, because they tend to nosedive very quickly because they don't have the ability to think about decisions and they feel invincible. So, say by the time they go to college, there's a lot more alcohol available. They're drinking every day now. Their tolerance is really high. They might even be known for their tolerance, and everyone knows them to be a heavy drinker, and they're the, party central and everything's fine. But they're massively hungover often. They start to be unable to do their schoolwork, obviously. They don't go to class sometimes. They start to identify as a partier. They start to identify as a non-academic person, and, they drop out eventually. But they're convincing themselves the whole time, I don't need college, and that's how it goes on. It's just like little decisions here and there. And then you fast forward to the age of 30 and they're drinking all the time and their health is really poor. Their relationships are chaotic. All of their friends and all of their romantic partners also have an alcohol problem. And they are on a road to destroying their life, their health, their liver, their brain, their relationships. They're stunting their emotional growth. At 30, they deal with emotions the way a 13-year-old does because they've never dealt with emotions in a sober way. So overall, it is massively destructive, even though it can provide some temporary numbness away from the pain. And this is why we need to help people with actual therapy in conjunction with recovery.
They're very poor moderators of their own behavior.
Has Mr. Depp suggested, based on your review of the record evidence, that alcohol and drugs actually help him?
Actually, in a review of the evidence, he has suggested that alcohol, Xanax, I'm in the list of medications, do help. Although I will also tell you on review of the evidence that there were at least 2 times I can remember that Mr. Depp was referring to at least short-lived periods of sobriety, and I cannot exactly tell you what that included. That both times he said that he functioned better and that he recognized that alcohol and drugs was at the root of his problems.
Right, which it lends itself to further down the road of recovery if he could admit that. In contrast, you might hear from someone that was, say, forced to quit or temporarily felt like it was a good idea to scale back on a certain substance. They might say, you know what, my life didn't really improve. In fact, it got kind of worse. You'll hear people say that sometimes, which, case-by-case basis, but usually it's really not true.
What I'm here today is talk about how drugs and alcohol affect what we all have in common. We're all human beings. We can all only get so much, take so much when something is going to happen. And that's what I see every day in the emergency room, on the consult service, on inpatient psychiatry. Bad things happen, not because of anything special, except we're all human beings and our brains, substance abuse, are not titrated. They're not regulated by the FDA. We don't know what we're getting. We don't know how much we're getting. There is no control over what makes it to our brain. So it is not the actor. It is not the persona. Okay? It is a person just like the rest of us who are human beings who will have these effects. And that's what we all share in common.
So if I was to take a guess, what he's trying to get out ahead of regarding the jury is, okay, you've seen Jack Sparrow, who is drunk all the time. Look, there's him on screen where he's put together and he's a good actor and they can cut and edit and all those kinds of things, wait for him to be sober enough to perform or whatever. And then there's the reality, which is that no human being with the amount of substances he was using would be able to handle that and have their life be functional. The other thing I'll say is that I've actually watched up until Amber Heard's testimony. I haven't posted those yet because I was in the middle of trying to catch up. There's so much stuff to watch. And honestly, I'm really interested in all of it. And I actually recorded some episodes reviewing all the evidence that we have thus far. But anyway, so as I post this video right now, I have actually gotten up to the point where Amber Heard has given a lot of testimony. So I heard from Amber Heard that Johnny Depp, had this moment where he was cavity searching her and searching for drugs, and it was very traumatic for her. And I will say that the story sounds believable. Of course, none of us can know because it was just two people in the room and it's he said, she said. But given the pattern of his use, and in particular his cocaine use, it would not surprise me that he had an episode like that. I don't know, but it was very likely, given what we heard from Amber Heard, that Johnny Depp was having a psychotic episode related to his cocaine use. It's a well-known phenomenon that when you take those substances chronically, you will have, in all likelihood, moments of a complete psychotic break from reality where you might hallucinate, you might have delusions, and the way she described it, it very much sounded like that. Now, on one hand, you might say, well, he was temporarily insane because he was delusional. It sounded like that she had hid his cocaine inside of her orifices. And that's not a normal thought, right? It doesn't make any sense. Why would she do that? It also isn't consistent with other behavior we've heard. We didn't hear, even from Amber Heard, him exhibiting that kind of odd behavior. So it probably was a temporary psychosis that he went through as a result of cocaine use. Might he have had multiple moments like that? Maybe. Was this the worst one? I don't know. Yeah. And then I was also saying that how do we categorize that? Because if someone was delusional temporarily and they take actions that they wouldn't do normally, do we call that person a perpetrator of intimate partner violence? Like, for example, I had a client who had an episode like this and he committed a crime against his mother, and in the end we all determined that it was temporary psychosis, and it was very odd. And he described it fully in terms of like, you won't believe what was going through my mind. I believed this, that it made no sense, and I won't tell you the details because it's actually pretty awful. And I believe the justice system determined that, well, as long as you're getting treatment and you stay sober, then there won't be any charges because there wouldn't be any use in charging you with this. Plus, the mother understands, and she was horrified and traumatized, but she understood that he was having a psychotic episode that he probably wouldn't have if he ceased to use. Now, by the way, I didn't know that in the span of time I had with him. He was of the age where he could have actually had an emerging delusional psychotic disorder of some sort. But we heard that. So that's just another element to how severe his drug use probably was and how problematic it was in their relationship.
Everyone in this courtroom shares that in common.
When Mr. Depp was in his relationship with Amber Heard, was he a polysubstance abuser?
Was he in what substance abuse?
Polysubstance
Yes.
abuser?
So
Can you explain to
leaving
the jury
your-
what that is?
Overruled.
I'm sorry.
Okay.
Go ahead.
Okay, so polysubstance abuse is the use of three or more substances.
Yeah, when the lawyers in the past have gone down this road before, it's not a complicated word. It's just a word we use to label someone who uses a lot of substances and will abuse all those substances potentially. Because often there are people who will just abuse one substance, just alcohol, just meth, this sort of thing. Or if they use other substances, it's not nearly at the level of abuse or problem that the main drug of choice is. But there are people that will use lots of drugs and they don't necessarily care that much as to which drug it is. They just want to be not themselves, and so they will and I've worked with people like this, and these people tend to be more problematic because they're seemingly just desperate not to be sober. Also, when you're pulling your brain and your body in all these different directions, there's a lot more chaos and a lot more health risks and psychological risks, behavioral risks.
And I answer, like I said, concurrently, he was. Even while I was getting ready for rehab on the island, he was. So, yes, he did engage in that.
Now, I don't know what he's referring to, but I think what he's referring to are the benzo use. In the chemical dependency world, I imagine, this is just anecdotal, that if they heard that Johnny Depp, while trying to recover, was still using marijuana, was still drinking occasionally, but not seemingly to excess, was still taking benzos every day, was still taking a psychostimulant like Adderall or Ritalin or something, a lot of people in the chemical dependency world would say, you're not really in recovery. I appreciate that you're cutting back on the opiates, which is great for you, but when you want to really recover, we'll be here for you, that kind of thing. I think that's what he's referring to.
Did Mr. Depp's drug and alcohol abuse affect him cognitively?
Yes. So if nothing else to look at, Dr. Blaustein, psychiatrist that evaluated Mr. Depp, did a mini mental state exam on him. And as part of that mini mental state examination, you're asked to remember 3 words and then come back 5 minutes later and repeat those 3 words. And in the meanwhile, you're getting other types of testing for attention and concentration and visual, spatial, and language. So other things that are being tested.
All right, I didn't know this, that there's a Dr. Blaustein or something that evaluated Johnny Depp and did a number of different tests, including the mental status exam, mini mental status exam, which involves what he's saying, where you there's different forms of this, but you would give to the individual that you're testing 3 words. Some later point in the interview, you ask them to try to remember as many of the 3 words as possible, and if they can remember all 3, then that indicates normal. Now, I wonder where Johnny Depp was in terms of his drug use the day that he was being examined. If he was completely sober and had been for a while, then maybe that would affect things. And as I've said earlier, benzodiazepines do affect one's memory, meaning that you're taking them every day.
Tested too. Mr. Depp was unable to recall any of them, and that is very unusual for a 50-ish year old male. I don't remember how old he was when he took that. Generally speaking, that age group should be remembering 2 or all 3 of those words.
Okay, so we're hearing that Johnny Depp couldn't remember any of them. Again, I wonder where he was at in terms of his drug use at the time, his state. I'd like to hear the rest of the mental status exam or hear from Johnny Depp, like where he was in terms of his drug use at the time. But who knows? What the evaluator here, Dr. Spiegel, is concluding is that he's had, I think what he's saying is brain damage from the amount of substances that he's been using over the years, which is absolutely possible. It's absolutely possible for Johnny Depp to have a variety of cognitive deficits as well. We can never know exactly where those deficits come from, but drug use and at the level that he's been talking about, Johnny Depp, even himself, a lot of people, if they did detect a premature cognitive decline, would probably point to the substance use. Yeah, for sure.
One, I do know that his lines were also fed to him by earpiece. Again, affecting memory. I did see video deposition about having to have questions, I don't want to say repeat as much as completely forgotten. So,
all right, I think we did hear that from another witness, that Johnny Depp at a certain point started to, while on camera, would require an earpiece while someone fed him his lines. And then another thing he's saying, he saw an interview videotape of Johnny Depp and he would forget the question and have to have it repeated. Again, I'd need to know where he was in terms of his drug use. Was he intoxicated on those days? Because if he was, then that would be a temporary cognitive deficit and not a permanent one. Either way, it's evidence of something, though. It does tell us something. Even if it was completely drug-induced cognitive deficits, that would tell us that the amount of substances he was using made it so that he couldn't even remember any of the 3 words after a period of time, which is unusual.
The answer is yes. And any one of us who use alcohol and cocaine to that level of degree, and I'm talking about a severe level of substance use disorder, are going to have effects. It is inescapable, because we all have brains that are malaffected.
So that's a dubious statement of what he said there. He's saying anyone who uses that amount of substances will have cognitive decline. That is not true. There's a high likelihood of there being a cognitive decline, a measurable cognitive effect, but not everyone. Not everyone. There's very few things in health, in medicine, in psychology that can be applied to everyone. I don't agree with what he's saying right here. And I know that research doesn't support what he's saying right there. If you would have qualified it by saying, in my experience, I've never met someone, and research supports this, who used as much drugs as Johnny Depp has even said himself, that did not have a cognitive decline. You could say that.
By extensive substance use, and potentially sometimes less, but certainly what we're talking about here is extensive.
Now, do I doubt what he's saying? No. Do I think that Johnny Depp has had no effects on his brain and his cognitive abilities due to his chronic, lifelong, since he's been 11 years old, substance use, polysubstance use problem. Do I think he has some problems in his brain? Yeah, I don't doubt that. I would have a hard time believing that that wasn't true. But there's no way to say that based on one exam. But this does say something, as I've been saying, that if this is representative of at least some of the time, if not all the time, that Johnny Depp was operating while in relationship to Amber Heard, then it does call into question a lot of his statements and a lot of his memory that the jury would benefit from hearing if you're on the Amber Heard side. The other thing I'll say is that someone emailed me this, they go, you got to watch this. And they also said that people are review bombing, which is just a wonderful word, sarcasm. People are doing this to Dr. Hughes in that they side with Johnny Depp. And when you have an expert witness on the other side who is just doing their job, this guy hasn't said any. You could argue that Dr. Hughes was out of line because of the way, I've already been over that stuff. But to attack someone online, to lie and give them a bad review, tweet about it. You can do that. Post something on Reddit. You can do that. To go to their website and to potentially ruin their career because you just didn't like what they said. That's online bullying. And to look at, now, so, yeah, you know what I think about that. It's just, no, it's not okay. Don't bully Johnny Depp. Don't bully Amber Heard. Don't bully the expert witnesses. These are regular human beings. They're doing what they're trying to do. They're trying to survive. They're just getting by. They didn't attack you. So why would, and I'm not saying you, because I'm sure none of you did that, but it's wrong, and we need to see it as such. And even if you are pro Johnny Depp and you hate Dr. Hughes and you hate Dr. Spiegel, you should be speaking out against people who are online bullying these individuals. It's not okay, especially the expert witnesses. They're just doing their job. They're doing their regular job. Now, you could, because you've heard me say this before, you could take issue with the industry of forensic psychology, as I have. I've spoken out about it. Watching this trial has reinvigorated my criticism and my critique of it, which I'm not alone in having that critique, by the way. You can say that, you can talk about that, but that's the industry. It's not these individuals. These individuals are doing standard work as forensic psychologists. So to attack them is totally uncool, totally uncool. And I'll tell you that I had a supervisee once. It's totally different but related scenario where my supervisee, and I wasn't there so I can't tell, but I believe in a nutshell that she met with a client. It didn't go that well. The client had some issue of some kind, some perceptual problem, perhaps a personality disorder, I don't know. But the session didn't go well. It was the first session between my supervisee and this new client. And the new client terminated and said, I don't want to work with you, and went home and wrote this really nasty review online of her. And she was in the beginning of her career. And we don't know, but up until that point, her career was on the rise. I was actually marveling at how fast she was getting clients, particularly couples. She really wanted to focus on couples. And she was doing really well. She was marketing. She was going on television. She sort of got her way onto a local TV show as a regular guest. She had this one review, and almost no new clients called her because, people Google their therapist before they make an appointment. She concluded that one unhinged lie, and there were lies. I don't know if there were lies, but my supervisee was saying they're lies, and I tend to believe her. And the allegations seemed outlandish from my memory. That because of that one review, her career in private practice was over, and she waited it out. She tried to recover. She tried to reach out to I don't know if it was Yelp or Google, but she tried to reach out and say, look, this person is saying things that aren't true. Like, you have to take it down. I'm in the beginning of my career. I have one review. And the other thing is there's not a lot of reviews out there of therapists. I've been practicing for 25 years. I think I have maybe one or two online reviews from clients. It's just not one of those things that clients think to do. And it's unethical for therapists to ask their clients to do it. It's considered unprofessional and coercive to even suggest that a client fill out an online evaluation of you to review you. So as a result, a lot of times the only reviews you're going to get are from people that had an abnormally bad experience with you. Anyway, now, can therapists be bad and have bad reviews? Yeah, absolutely. It happens all the time. You know me on the podcast, people email into me, very credible stories about therapists behaving badly. I've been an expert witness in situations, or an evaluator in situations where the therapist absolutely was unethical and abusive and horrible. It happens. Anyway, point is that don't review bomb. And you can't just sit by and watch that happen and just be like, well, I'm not doing it. Like we have to collectively as a culture, this is a new thing. So we haven't developed the morals and the mores and the culture around how to see that sort of thing. There's a group of people that think that this is a viable way of expressing your opinion. It's not. It's not.
Did you observe from the record evidence about Mr. Depp having difficulty focusing, his attention span, processing, whether he could function as an actor?
So,
Objection compound.
Compound is only if it's overruled. Thank you.
Having said all that, rant, is he potentially biased because he was hired by the Amber Heard team? Maybe. I don't know. I can't accuse him of that. But is he saying things a certain spin because they are the one paying his bills? I don't know. But when we look at courts and we look at forensic psychologists and expert witnesses along these lines, they often will say exactly what the lawyers who hired them want them to say. And you'll get opposite things being said by opposite expert witness forensic psychologists. And what does that tell us? I don't want to accuse him of that. Like I said, his opinions are pretty mundane that anyone, including myself watching this case and I don't have the benefit of looking at all the material that he has, those labels of polysubstance use disorder and intimate partner violence perpetrator. Well, so that second one, is that a problem? Yeah, I mean, you've heard me say that. Dr. Curry said what I believe I would have said. I'll just put it that way. When the lawyers asked Dr. Curry, do you believe that someone was a perpetrator? She said, I can't evaluate that. I can only go off of what was reported to me, and thus I have no way. We don't have an instrument to decide if that happened or not. I can only tell you how I diagnosed them based on what I heard from them. And there's no diagnosis for liar or someone who has been a perpetrator of intimate partner violence. There are, judgment calls in this situation. So could you claim that he crossed the line there? I don't know. I mean, he has more information than we do. So maybe there's just like, oh, this is undoubtedly an indication that he was I can't imagine that being true, though, given all the possibilities as to how the evidence against Johnny Depp could have been lies, could have been fabricated. By the way, other people are also reaching out to me saying that Amber Heard stole Ms. James' story of sexual assault. Ms. James has come forward, I believe, saying that Amber Heard's allegation of sexual assault via a bottle, I believe, was the same story that Ms. James, I think, might have disclosed to Amber Heard a long time ago. And so is there a possibility that Amber Heard was just trying to invent something? At the flip side, could Amber Heard and Ms. James been through a very similar assault experience? Absolutely. A lot of people have been through similar assault experiences. So, it's just he said, she said, there's no way to know. And if we believe, which I believe, that Johnny Depp has cognitive issues, either in the moment or trying to recall a moment, is it possible that he could have done something like this and not remembered it? Yeah, absolutely. Having said all that, could Amber Heard be completely lying about everything? Yeah.
Memory is going to be impaired. It is inescapable that that's going to happen. So all that comes into play there. And that's what I witnessed in the video deposition. Fortunately for Mr. Depp, I do see that during this trial, his cognition has improved somewhat, which will happen if you are sober. So I commend him on that.
Okay, right. So, because I was thinking, I haven't seen any evidence of that in his recall and answering questions in this trial. Johnny Depp seemed completely capable. Might he have some effects that wouldn't be detected in someone that was giving testimony like this? Sure. But I think what he's saying is that the effects on his cognition, on his brain, were temporary based on his substance use.
Observations from the record evidence did you have about Mr. Depp having alcoholic blackouts or foggy mind?
Again, there were reported times where he would be essentially, quote unquote, passed out drunk. You saw pictures of him passed out drunk and not being able to remember what he did, which is, again, if you look at the record evidence, you will see that, and this is linking intimate partner violence and substance uses together. I know we're going to get to that, which is basically if you have blackouts and you're using alcohol or using cocaine, it's going to be near impossible to remember what happened the night before. I don't think I'm the first person that's ever told you that alcohol can cause blackouts.
Right. So might that be a factor in him claiming that he didn't do these things? Absolutely. If you've been abused by someone who used heavy amounts of alcohol, you know that the perpetrator will wake up the next day and have no memory of what happened. Sometimes these perpetrators will remember enough to say, I bet you that thing happened again. But sometimes they'll just be like, you're making that up. Because another part of it, if you're really holding on tight to that substance, which I think Johnny Depp was, it would be strange if he wasn't holding on tight. He claims he needed it to function in life and became very addicted to it. But when you're told, hey, last night, do you remember doing this and that? And the individual who has a substance use problem is faced with a why in the road. They can believe what the person is telling them, or at least believe mostly what they're telling them, and then they have to accept that they did something horrible, and they have to accept that they don't remember that it happened. So there's a lot of indications that I have a problem. If it's me, it's like there'd be a lot of, whoa, I got a problem. I don't remember doing that. That sounds awful. What's wrong with me? And then it starts to lead down a decision tree of I need to stop drinking, or I need to cut back, or something, or I need to go to treatment. And the addict mind that's holding on tight to the substance will do everything it can to divert you away from that thinking. And it's just a metaphor. It's not an actual mind. It's just, a defense mechanism, you could say. But there's another available path, which is much easier, which is just say, you're wrong. That never happened. I don't know what you're talking about. And to believe it. Because if you believe it, then you don't even have to think, even in your soul, that you have a problem. It's easier to deny reality. It's easier to deny your spouse the opportunity for them to tell you what you did wrong. It's easier to deny them validation. It's easier to maybe even do things to undermine them and, get out ahead. You'll see people that are suffering from addiction. They might actually text their family members and say, oh, she's talking crazy again. She's saying I did things last night. I didn't even drink last night. I don't even know what she's talking about. So could that have happened? Yeah, but there's no evidence of that. I'll just have to say.
And basically, alcohol decreases a brain chemical, glutamate, which is involved in memory formation. If it blocks that to an extensive degree, the individual cannot remember what happened because they didn't have enough time for their brain to process the memory. You need this brain chemical. So does alcoholic blackouts happen every time? No, of course not. But are they a complication of a use disorder? Absolutely yes. And there was record evidence of that.
I'd like to see the evidence. I hope they ask, okay, then what was that evidence? What you have evidence that he had blackouts. What was that? And maybe that has been already presented and I just haven't seen that footage yet. And then you'd also have to do a follow-up question of, okay, if you have evidence that he did black out, do you have evidence that he was abusive during one of those blackouts and wouldn't remember it the next day? And I don't think they have that evidence. All right, well, that is it for that episode. Everyone out there, please take care of yourself because you deserve it. You really, really do.